Hi everybody, I'm not at home. I'm visiting with some friends, but I like doing these Facebook Lives, so you get me here. Today I'm going to debunk the myth about whether pregnant and birthing women should be the decision makers about their birth. And I'm debunking this myth because on my flight from home to here, I actually had a conversation with a woman who was talking about her births and was saying that she gave birth when New Zealand shifted over to this midwifery-led maternity model. And she was asked by her midwives what she wanted and what she didn't want. And all she could think to herself was, how am I supposed to know? I don't have the training. I don't have a clue. And so she really was put off right away by being asked, well, what do you want and don't want? And so I decided to talk about this because when I first gave birth in 1970, this wasn't a choice. Do I think it's bad? Well, it really doesn't have anything to do with me because I represent a charitable trust, and that charitable trust represents the hundreds and now tens and thousands of birthing better families that developed these skills to begin with. And so my voice is the voice of their stories. Most of us would like choices around our health care. Of course we would. It doesn't just go for pregnancy. We would like choices. Do most people actually go to their doctor if they have diabetes, or if they have a heart problem, or if they have asthma, or if they have urinary infections or yeast infections, and say to their doctors, I'd like this or that? No, they don't. And the reason is that if they wanted this or that, they would probably be doing this or that. So we often go to our healthcare providers, whether it's a doctor or a naturopath, an osteopath, a chiropractor, because we can't figure it out ourselves. So it's fine to be a decision maker about things, but it's also, we have to understand, what are we actually asking people to do on our behalf? So around pregnancy and childbirth, because it's such a one-off experience in a woman's life, even if she's going to be pregnant 10 times, that's infrequent. And so, as I talked about in another video, we tend to ritualize very infrequent experiences like weddings. So we put a lot of emphasis on weddings, not much emphasis on marriage. We put a lot of emphasis on pregnancy and birth, and not so much emphasis on raising children. And that's okay, but we have to understand that we ritualize these one-off big experiences. And pregnancy and childbirth is a normal life event that can be full of all sorts of health issues that we bring into us. What I just mentioned, diabetes, urinary tract infections, vaginal infections, asthma, can be brought into pregnancy, and pregnancy can either make those things better or worse. So in modern cultures, we use healthcare around pregnancy because a pregnancy can exacerbate or improve conditions that we have. Childbirth just is a shorter time frame in which problems specific to birth can arise, just as problems specific to pregnancy, like preeclampsia, high blood pressure, protein in your urine, things like that. Then there can be problems with the baby that we know are diagnosed or unknown. So can women actually be decision makers around pregnancy and childbirth? When we started to look at birth plans in the 80s, it would be amazing what women wanted to have decisions about. We wanted music, we wanted to eat, we wanted all of our children there, we wanted to walk around, we wanted not to be touched, we wanted to be in this position or that position, we wanted the baby to the breast, we wanted delayed cord. We had things about entering hospitals or things about when midwives came to our home, all sorts of, it was detail oriented. And the fact was that most of those things just flew right out the window. Once, if women labored, they really all ultimately didn't care about it. Very few things. So birth plans got filled with what were called menu items or wish lists. And they were complicated. And you would hand them to a birth professional and they'd just look at them and they'd go, oh my God, she wants all these things. And they're not hired to do that. And they have, a hospital will have its own standards of care and guidelines. Your obstetrician will have those. And sometimes those don't interface. You can have an obstetrician who's perfectly comfortable with you trying to have a vaginal birth after 6 cesareans, and your hospital might go, yeah, not. So there is a whole conflict about what you can make decisions about and what you need to bother to ask people about. Do you really need to bother to say on your birth plan, I want music or I want to eat? Just bring those things, do those things. Don't tell people about it. That's not really an important decision that is going to be disputed. The medical profession is there to do assessments, monitoring, procedures. Those 3 words have been now lumped into the word interventions. And the word intervention has been implied or come to mean unnecessary and imposed on you. And so you should really make choices about those interventions, or what we call assessments, monitoring, procedures. So what Birthing Better Families taught me was, if you do not want any medical assessments, that means no listening to the fetal heartbeat, no vaginal exams, no blood tests, no nothing. If you don't want any monitoring, if you don't want people to come and regularly listen to the heartbeat, if you don't want people periodically to come in and monitor your progression or whatever they do for monitoring, if you don't want any of those, and if you never want a procedure such as your membranes ruptured or your cervix being stripped or augmentation or an induction, if you don't want any of those things, no matter what that list is, then don't go to the hospital for any reason. That's it. Because you are in an environment that has, right or wrong, good or bad, an evidence-based practice. And as I've said, I've lived through 3 of them. So they change. So the standards in your hospital will change. So can you actually make a decision about the outcomes of saying no to assessments, monitoring, procedures? No, you can't. That doesn't mean you should accept everything. What it means is, accepting everything means that you have to live with what happens from accepting. And if you say no, you have to live with what happens from saying no. In other words, making a decision is not the same with living with the consequences of that decision. And we don't know what the consequences of that decision are. And that's what we're faced with. So if we don't want to be induced because we are post 42 weeks, we have to live with the decision of not being induced. If we get induced, we have to live with the decision of being induced. And this is where the decision-making issues around women in childbirth have gotten confused and need to be debunked, because there is no explaining to you that what comes from any decision is unknown, and you have to live with the consequences of it no matter what it is. So does decision-making play a part of it? It does. However, what we've discovered over 45 years and talking to tens and thousands of women is that it is not so much the decisions they make, it is the behaviors that they bring into the birth that often elicit the responses from care providers about these assessments, monitoring, procedures. So for instance, if you have a woman who is coping well in labor, it is less likely she's going to be asked if she wants pain relief. Simple as that. A woman who has skills, who goes past 42 weeks, is more likely to make a decision, yes or no, to an induction, and be okay with using her skills, even though she's had her cervix stripped, membrane stripped, or her water bag broken, or is given an infusion or a suppository to have an induction. Because what she does is to say, I'm making that decision, I'm going to live with the consequences, but I have the skills to cope and manage with how my birth is unfolding. That's not maybe how I wanted it to unfold, but that's the decision that I'm making at the time, and I'm making it consciously. But I'm going to use my skills. But we don't hear that because 99% of you are unskilled. So you're trying to wrest control of your birth by decision making. You believe if you say yes or no to something, that you are in control of that. And that's the myth. You're not in control of it. You can say yes or no to anything, but it's the outcome. It's like the wedding. You planned the wedding. You didn't put a lot of focus for most people on the marriage. And it's the marriage you have to live with. The birth you will live with all the time. It's sort of like the wedding, but you can't really plan it because it will unfold in unpredictable ways. But you have to live it. And it's sort of like the wedding and the marriage all rolled into this one very short period of time. You have to live it. And that's why skills became so important. So whatever decisions you make around your birth, or whatever decisions you don't make around your birth, you are living with the consequences of it. And because I've been privileged to be around childbirth, not as a midwife or a childbirth educator or a doula, but I have been at a gazillion births, and I have watched good things happen from decisions, and I've watched challenging things happen from decisions. And that goes in all sorts of ways. So can I honestly say from an outside observer that women as decision makers are great at knowing what the outcome of the decisions they make? No, of course we're not. And that's what that woman said to me on the plane yesterday. She said, I didn't know what decisions to make because I didn't know what the outcomes of those decisions would be. Now, I had a personal experience last year. I had a ruptured appendix, right? They didn't think it was ruptured at the time. It wasn't until after the surgery that they discovered it had ruptured. But the anesthesiologist came in and said to me, you know, there are risks of my putting you under. You could actually die. There are risks of this surgery. And I thought to myself, what am I going to say no to? That wasn't the best time to be asked about decisions. So when women are in the throes of birth and somebody feels, for instance, their baby's heart rates are irregular, we think that X, Y, and Z should happen. There are very few women who will say, no, I don't care, I think the baby's fine. They will go ahead with that. When they go ahead with that, when they lack skills, then they start to feel out of control. And that's the one thing we have to understand is that we use decision-making around pregnancy and childbirth as a huge element of remaining in control. And the reason we do that is because that's always all we have left women with is choices. We haven't in any way said to them, it is your behavior, your skills, your ability to cope, manage, deal with, stay on top of, and stay in control of whatever is unfolding because you have skills. So I will do a whole series on the truths around childbirth because debunking the myths are really essential. And if I had done the truths first, decisions, I'm not certain you would have understood them or listened. So I'm debunking the myths, and then I'm going to come back and talk about the truths because the truths simplify birth. And you're already hearing it. Everyone should become skilled. So what can you do to help grow a skilled birthing population in your local area? Direct people to these live chats. Begin to learn to give the message yourself that all of these factors are around everybody's birth. But if you become skilled, you'll remain in control. Pass this on through social media. Begin to articulate it yourself so you can say to your friends and to your relatives and to your children, become skilled when you give birth to your baby. And give that message to both the mothers and the fathers. We all need to be skilled. None of us should feel unskilled to birth our children, no matter where we birth, who's present, or what happens to or around us, or the decisions that we make, the yeses or the nos that we give. That's how you can help us to grow a skilled birthing population throughout this world, because we need skilled birthing women and skilled birth coaching dads or others. It's as simple as that. So see you again tomorrow. Bye-bye. Oh, today is the 16th of January 2018 in New Zealand.